Hello, and welcome to Funders as Community Partners. My name is Jan O'Neill, and I'm a community coach with the County Health Rankings and Roadmaps program, and I'm joined by Kate Conkle.
Hi everyone, this is Kate, and I will be chatting out some links to you today as well as monitoring your questions as they come in.
So this webinar will help you all think more broadly about the role of funders beyond their monetary contributions. We're delighted to be joined today by our guest presenter, Necole Irvin, Program Officer with the Houston Endowment, who will talk with us about what the world looks like through a foundation's eyes and how local community leaders can work effectively with philanthropic partners to get more out of their improvement efforts. But first, we'd like to acknowledge the important relationship we have with the Robert Wood Johnson Foundation. The County Health Rankings and Roadmaps program is a collaboration between the Robert Wood Johnson Foundation and the University of Wisconsin Population Health Institute. And thanks to the support of the Robert Wood Johnson Foundation, we have 4 community coaches in the County Health Rankings and Roadmaps program, and our assistance is no cost to you. So please don't hesitate to contact us if you need assistance with a tool, a question, a next step in your process. We're here to help. So next, we wanted to take a moment to get you oriented to the technology we're using today. The GoToWebinar attendee interface is made up of 2 parts. On the left, you can see the viewer window, where you'll see my screen throughout the presentation. And on the right, you can see the control panel, which is where you can interact with us. Because of the number of people we have on today's webinar, we're going to be taking questions via the control panel. So feel free to enter your questions in the control panel at any time, and we'll save your questions for the Q&A toward the end of the webinar. If you have a comment, please feel free to chat that as well. So here's what we're going to be covering today. First, we'll give an overview of the County Health Rankings and Roadmaps program, and Kate will be chatting some links during that time, so if you're familiar with the program, feel free to go and explore those. We'll also then follow that with examples of funders in action, different kinds of ways that funders have supported efforts in communities. Then we'll turn to the interview with Necole Irvin and follow that up with Q&A with all of you, and then finish up with some resources and tools for taking action, and summarize and close. So now we'd like to know where funders are in your community improvement work, and I've just launched a rapid action poll. So if you could take a minute right now, and you can provide more than one answer if it applies, we'd like you to please take a moment and vote here and let us know what's going on in your community with regard to funders. Okay, I want to give it another few moments here. Again, you can answer multiple answers here. Okay, and I am going to just about close the poll. 3, 2, and 1. And here we go. Let's share what that looks like. And very interesting, Kate. We've got 79% are supporting programs, practices, and policies. But there's some other roles that they're playing in communities too. The largest, next one being fostering multi-sector partnerships and convening conversations, which Necole will be talking about a lot.
Yeah, so great to see funders really participating in a variety of ways in communities.
Yeah, that's really great. Okay, so I'm going to close that. And I think everybody should be able to still see my screen. Can you see? my screen. I've got the essential question up now. And should be showing the, can't see the essential question?
I still see the poll, and it looks like we've got a few viewers who are still seeing the poll as well.
Yeah, let me get rid of the poll. So, there we go. All right, here we go. Sorry about that, folks. Okay. So here's our essential question for today, and we've really woven this whole webinar around this question. And we'd like to sort of tee up the Q&A and also give you some questions for reflection throughout this webinar. So be thinking as we go through this, who else do you need to share this information with? And what's one idea for action that you're taking away? And what else do you need to know to take action and use this information? So some thoughts to get you thinking through this webinar. Okay, so I'm just going to do a brief run-through of the program. So with County Health Rankings, we give 2 ranks to the health of nearly every county in every state once a year. And for each county, you get a rank for health outcomes and one for health factors. And there's 2 separate sets of messages that this conveys. One is how healthy a county currently is, that's health outcomes, and then how healthy a county might be in the future, which we call tomorrow's health, based on the many factors that influence health. So what are those factors? Because much of what affects our health happens beyond medical care, the rankings underscore how important it is to build a culture of health where getting healthy, staying healthy, and making sure our kids grow up healthy are top priorities. The model shows the relationship between policy, health factors, and health outcomes. It illustrates how multiple factors impact how well and how long we live. Things like how we commute to work, housing conditions, access to parks, the quality of our schools, availability of jobs, access to healthy foods, clean air and water, and our social connectedness all impact our health outcomes. So starting from the bottom, we know from the research that effective local, state, and federal policies and programs can improve a variety of factors that in turn shape the health of communities. And many health factors shape our community's health outcomes. We specifically, in the rankings, look at health behaviors, clinical care, social and economic factors, and the physical environment. So why do we rank? We rank counties within states to provide community leaders with a tool for calling their communities to action. And when the reports are released each spring, they garner a lot of media attention, which provides community leaders with the leverage for mobilizing multiple sectors to get involved in taking action collectively, action that is evidence-informed and focused on the community's health priorities, action that will ultimately, over the long term, result in longer, high-quality lives for children and adults in the community. So there are 4 core principles that are at the heart of roadmaps. First, it takes everyone, all of us, working together to improve the health of the community. Second, we need to move as quickly as possible from data to action, not get stuck in analysis paralysis or drowning in data. We encourage communities to look to the evidence to inform these actions, and if you innovate, be sure to evaluate. And third, keep focused across the health factors, including social and economic factors, which contribute 40% to health outcomes. And finally, don't be afraid to take on policy systems and environmental change, which will create the greatest long-term change in the health for children and adults in your community. So now let's turn to the different roles that funders can play in this partnership toward better health in a community. When we talk about it takes everyone, everyone includes philanthropy and investors, funders in a word. Funders can play a variety of roles in improving community health. They can play a unique role in fostering partnerships across organizational boundaries, helping people find common ground and shared mission. They can support data collection to assess community needs and evaluate the effectiveness of programs and policies. They can incentivize grantees to focus on actions that will address community needs. And they can support evidence-informed policies, programs, and practices that will make a difference for vulnerable populations. They can engage in public-private partnerships that leverage funds for greater reach and impact. And they can support communities in building their skills, knowledge, connections, and capabilities that will sustain improvements over time. So let's take a look at some examples of what this might look like, or does look like right now in our country. And one example comes from South Salt Lake, called the Early Learning Network, and it's a great example of convening and fostering partnerships. It's a very unique public-private partnership, and the local United Way partnered with Goldman Sachs and J.B. Pritzker to create a social impact bond focused on increasing school readiness and academic performance among at-risk 3- and 4-year-olds. The initial $1 million investment has enabled 600 additional children to attend preschool, which will increase their readiness for school, which will help them be more successful in school, leading to a decrease in dropout rates, substance abuse, unemployment, and crime. And the great news is, in March of this year, the Utah State Legislature passed the legislation needed to fully utilize the social impact bond fund that the United Way of Salt Lake created through private investments. So that's one example. Another, actually, United Way example is in Santa Cruz, where they've been instrumental in collecting and disseminating data. They've produced the Community Assessment Project for over 20 years to establish needs, guide priorities, and measure progress. And Santa Cruz was an RWJF Culture of Health prize-winning community last year, and United Way there is a big part of their success. Now turning to another prize winner, the Greater New Orleans Foundation, which serves Southeast Louisiana, supports 9 different categories of community and human development. They support nonprofits working in economic development, community safety, education, family and social support, the environment, arts, and culture. As an example of incentivizing actions in the environmental field, they brought together nonprofits to create a complementary group of pilot projects that will provide models for other coastal parishes to use as they adapt to the realities of wetland loss. And as I mentioned, New Orleans was another RWJF prize-winning community last year. Now turning to North Carolina, the Kate B. Reynolds Charitable Foundation is working with rural, high-poverty counties to support them in selecting policies, programs, and practices that have a strong evidence base. Projects to improve health are locally led, and the trust is reaching far beyond the sorts of healthcare organizations they've traditionally funded. So as examples, so far the trust has funded new walking trails, playgrounds, a nurse-family partnership program to help first-time low-income moms, and a juvenile justice treatment program focused on working with youth in the court system. In Missouri, as an example of leveraging funds in action, the Missouri Foundation for Health partnered with RWJF to hire a program coordinator and staff to conduct health impact assessments to show the connection between policies and public health. At the end of the project, the findings were presented to the Columbia City Council and the Boone County Commission, and this led to increased transportation services for vulnerable populations. Finally, here in Madison, Wisconsin, just recently, local foundations from community development, business, and media partnered together to support staffing, thereby building capacity for a recently formed local coalition which is focused on reducing racial disparities in education, income, and incarceration. And the foundation partners followed the coalition's lead in supporting what they needed versus asking them to participate in an existing initiative. So as the coalition leader commented, they heard what the African American community was saying. It wasn't come to the table. They said, set the table. Where do you want to shop? And this is a good segue to introducing our guest presenter, Necole Irvin. Necole is going to talk to us about lots of examples of what funders can do and how they think about funding. She serves as Program Officer for Houston Endowment Inc., overseeing grant making for the Foundation's health portfolio. Prior to joining the Foundation, Necole was Senior Program Officer at the Foundation for the Mid-South, a regional organization that promotes racial, social, and economic equity in Arkansas, Louisiana, and Mississippi. Necole has served as a Government Relations Director with an International Health Association and with the U.S. Peace Corps as a health educator and member of the guinea worm eradication team in the Islamic Republic of Mauritania. As a member of the RWJF Roadmaps to Health Advisory Group, she brings deep and rich philanthropic and community organizing experience at all levels, local, regional, national, and international. So welcome, Necole.
Thank you
Hello,
so much.
Necole.
Yes, I'm here. Thank you so much. I'm excited to be here today.
Great to have you here with us. So let's start with the question about what's on funders' minds. How do funders talk about funding? What are they looking for, Necole?
Well, thanks for the question. I definitely would like to start off by saying that funders are as diverse as nonprofits. When you speak with one funder, and I'm sure that everyone on the call has heard this, you are speaking with one funder. But there are several things that I hope my examples this afternoon will help to shed some light on maybe how funders think about, consider, and analyze their partnerships, their relationships, and the requests that come to them. So I'd say that, when funders talk about a grant or an award, they are really thinking about it from three different ways. How will it impact? How will their funds have an impact on the community? They talk about it as an investment, and they also talk about it from a leveraging perspective. And so in thinking about the impact, there is a strong emphasis on organizations that have a strong strategy and an emphasis on outcomes versus outputs. Do they have a strong evaluation? Have they thought about, planned, considered that component of the work and intervention that they're doing? From an investment perspective, whether it's a short or long-term investment, a funder is thinking about, considering, looking at that return on an investment. From a leveraging perspective, will the award serve as a catalyst? Is it an award that's helping to build evidence, to support scalability? A funder is usually looking at whether or not they are the sole funder for a project or an intervention. And if they are, will it be sustainable after their funds are done? Will another funder be interested in taking on that project? So those are ways I think that anyone that is beginning a relationship or looking at continuing a relationship with their current funder should think about framing your request from one of those different aspects. And I would also actively encourage organizations to really do an assessment of themselves and to understand who they are, to know their internal competence, understand and assess who you are from a financial perspective, operations, if you are ready, and articulate your leadership and outcomes for any request that you are putting forward to a funder. It's important for nonprofits to think about and keep in mind that funding a nonprofit in most cases is not a foundation's goal. Improving the lives of residents through the work of the nonprofit is the goal, and there is a common and shared mission with the two.
That is so helpful to hear that. So what you're doing is you're really helping us see through your eyes the world and helping us who are applying to you to think about what is our common shared mission, and then how and what are the most important things to you. So that's really helpful. Appreciate that. Let's talk for a minute about funders' roles. I talked a little bit about fostering partnerships, investing in strategies that work, collecting evidence. What are some of the other roles that funders can play, Necole?
So the first role that a funder can play is a thought partner, a coach, or a sounding board, helping to clarify, create, or retool a plan, an initiative, or an intervention. And I was thinking about a couple of examples of this. So the first, in my previous role at the Foundation for the Mid-South, we were a rural funder, and I was funding and working in the community during Hurricane Katrina and Rita. And as a Mississippi and Louisiana funder following Katrina, there were numerous instances where nonprofits were faced with issues, problems, challenges that they had never considered before. In many communities, small communities, there were extremely limited resources, and these disasters significantly limited their resources even more. And so an example is that groups began thinking about sharing office space, but there had been no examples locally for those groups to work off of. And so as a funder, I had seen shared office space in other communities and was able to help groups think about what are some of the challenges, some of the practical issues in structuring this idea of a reality of shared space amongst groups, to share that information with them and help to build and create what it would look like from a practical standpoint, and then how they could fund that shared space. Another example, actually during the same time period of working with the Foundation for the Mid-South, there were many communities, both medium-sized and small, and I know there are lots of folks on the call, and so medium and small could mean, depending on your perspective, any numbers from 200 to 10,000, and we still could be talking about small or medium. But I'm thinking specifically about a small community of about 2,500 residents. And this community in the Mississippi Delta had 0 nonprofit organizations, but they had a mayor who was visionary and really wanted to think about how to grow and change her community. And so as a funder, I worked with her and served as a sounding board in talking about how she wanted to move her community forward. So we worked together to strategize how to make change in the community and found a national initiative that they could join. And so while we served as a grant maker in that process, we really helped her to think about ways to advance her community. And that community of Itabena is now a part of a national initiative that helps communities address critical issues from a multi-generational perspective, and then working with the Intergenerational Center at Temple University called Communities for All Ages. That thought partner relationship brought not just a grant into that community, but networks across the country, capacity building, trainings, and additional resources. So those are 2 examples of being a thought partner with nonprofits. And then the final one I would say is, in my current job, I work in a large city. Houston is the 4th largest city in the country, and our foundation works across multiple areas. And in our work with the homeless organizations, the issue of homelessness, we have served as a thought partner with our grantees, having conversations with executive directors in strategizing moving forward on specific interventions. We've had conversations and worked as a thought partner with other funders in a group called Funders Together to End Homelessness. We have served as a thought partner with a collaborative of homeless groups with the Coalition Against Homelessness. And in all of those roles as a thought partner, we as a funder really have started to learn, maybe we have some common metrics that we use. Maybe we have some similar questions that we ask at site visits, and how can we share that with our grantees? And so a thought partner can be episodic, as my first example of shared office space, or it could be long-term, as my final example with working with organizations that are looking to end homelessness. So those are examples of a funder potentially being a thought partner, a coach, or a sounding board. A second role that I think a funder could play is the role of a connector. As a connector, a funder has a broader perspective of the work that's happening in their community, whether it is a funder who only does health work, but they are seeing not just the work that your organization is doing, but all of their grantees. They are seeing the work of not just their grantees, but other organizations that have maybe applied to them, but that didn't receive funding. And so when you think about your funder or someone who you are considering beginning a relationship with, you should really understand that they potentially have a broader perspective of the work that is happening either in the community with other groups or across within the intervention, within the field that you are working in. An example that I'd love to share with you is I was having a conversation with an executive director of a local breast cancer screening group. And we were talking about their work and the work that they do with community clinics. And throughout that conversation, I began realizing that our foundation was funding community clinics and work within that space. And this breast cancer screening group was doing work with clinics, but they had no idea that there were additional dollars available for them to collaborate. And so connecting this breast cancer screening group with community clinics with community clinic funding that our foundation was providing created a stronger, more robust partnership between the breast cancer screening group and the community clinics that we were funding. That connection happened based on a conversation that I was having as a funder with an executive director. So again, I would say that one should think about a foundation, a funder, as being someone potentially who can make the introductions and or linkages for you to other groups, to other resources. Your funder might be a member of another grant-making association or group and may have conversations with funders who you had not considered or thought about. And so again, thinking about your funder as a connector for you and the work that your organization does is really important. The third area that I would say in thinking about funders and their roles is that of a convener. A funder can help set the table for a conversation across organizations, across the community, and that role can be either as a interested party or a leader and or as a neutral party. A funder could be neutral in just providing the space and the logistics, in being seen potentially as a neutral entity to bring together all of the stakeholders. So in thinking about some examples in this space, I mentioned earlier that the Houston Endowment is a broad-based funder. One of our areas that we do funding in is the environment. Greater Houston is home to the nation's largest concentration of chemical manufacturing and refining facilities. We're also the second largest U.S. port, as well as having a sprawling footprint that encourages automobile use. So 3 factors that contribute to our air quality. And due to those facts, we do a significant amount of funding in the space of air quality and how it impacts and affects the communities that we serve. Our environmental program officer, in working with environmental grantees, served as a convener by bringing together all of our air quality grantees. And over a lunch here in our office, had each of the groups briefly talk about the work that they do. And while these grantees, some of them knew each other, some of them knew and had used some of the work of other groups, they not all sat together and taken the time to really understand the work of the other and to begin thinking about how they could better utilize each other's work and strengthen their relationships and partnerships. From that convening, we are starting to see some really exciting things that are happening with this group, whether that is an increased level of communication and network amongst the groups, whether that is coming together around a coordinated communications strategy, and they're coming together and deciding to present a request to our foundation and other funders as a collaborative group and working together to address an issue or problem. These groups have had amazing impact on our community, but I believe that our role as a funder in helping to convene them is going to exponentially leverage the work that they were doing in moving them forward. So the last area that I'd like to talk about in the role of a funder is that of a citizen consumer. I think that it is sometimes easy to forget that your funder is a part of the community. Maybe they're a client, a consumer. They may be a board member. They may also be an executive director of an organization, a volunteer, an advocate. They may directly benefit from your services or intervention, or maybe someone in their family does. And so really understanding and keeping in mind that your funder benefits directly or indirectly from the work that you are doing in the community is really important. It's also important, I think, as you think about your funder being the citizen consumer, is to find out and understand what the policy is within that your local funders, your local foundation. If you are considering bringing a funder on board as an official advisor or board member, and understand what their internal policies are, and consider the potential hurdles and or opportunities or possible loss of a direct advocate in proposing the idea of your funder being in an official capacity or a board role. So those are the 4 areas that I, as a funder, would encourage you to think about as far as roles as you are looking to expand beyond dollars. I thought it was fascinating in looking at the initial poll that the two lowest spaces are places where allocating resources strategically with other funders and supporting data collection and dissemination. So again, how do we think about foundations, funders, investors in a different way or in addition to providing the grant?
This is so helpful, Necole, and I really appreciate how you played off of the poll as well. And one of the questions we always ask people is, who else would you like to share this information with? So we're hoping that people on the webinar will share this over multiple roles with folks in their community. So what are some of the questions that you think folks should be asking of funders?
So I definitely think that, first off, if accessible, you should look at the list of your funders' other grantees. And if not, you should ask that question. Who else are you funding? Is it someone who has a similar mission? If it is, can your funder introduce you to them? Introduce you to another grantee, or possibly even to another group. Maybe your funder has learned of an intervention somewhere else, or another funder. So again, think about considering your funder as a resource, and how can they introduce you potentially to other resources. Have they seen or heard other initiatives that they could potentially connect you with? And I would definitely encourage, beyond asking for that introduction, to then ask them, not just at a local level, but are there folks that you should be talking with, working with at a state, regional, or national level? Are there individuals or other funders that you should be connecting with? Those are some of the important questions that I think a nonprofit should be asking their funders.
So really networking beyond the individual funder and building out relationships from there, using them to build relationships.
Definitely.
Yeah, great. Well, let's turn for a moment now to challenges. What are the challenges of being a funder?
Wow. So I think that I've been in the world of philanthropy almost for a decade. And when I first entered it, I thought, challenges? Actually, I seemed like maybe it would be relatively easy to think about helping to improve your community with resources and providing funds to organizations. But it is truly a balancing act, and it is a balancing act around request. And so in most cases, as a funder, I am not looking at really bad ideas or bad organizations or mediocre organizations. As a funder, I am tasked with deciding between really good and even good, or better good, or greater good, good and good, and great, competing areas of interest. And so that is a difficult or challenge for a funder in balancing requests. Another area of balancing is balancing stakeholders. Whether those stakeholders are multiple nonprofit organizations that are doing similar interventions, balancing the role of your foundation with a nonprofit, balancing your role within the community with a nonprofit, and potentially if your foundation has other staff, is a staffed foundation within that staff. And then finally, a huge stakeholder for me as a funder, as a program officer, is my board. So the foundation board is a significant stakeholder And so that community, the nonprofit, and the foundation board. So balancing all of those stakeholders is something that is a part of my daily work. Another area is balancing of time horizons, funding cycles within a foundation, and whether or not they work for or against potentially an issue area or a specific intervention that they are hoping to impact. Funding cycles and the length of funding, do they actually compete with the work that a nonprofit is doing? If your funder only funds on an annual basis, but the work that you're doing is going to take several years to have impact. So those types of balancing can be really difficult, not just for the nonprofit, but also the funder. And so keeping that in mind, I think, is really important. Another area, challenge of balancing are the internal structures, I'd say, in the nonprofit reality. And so it might be that your funder does fund on an annual basis, and their funding cycle happens right before you have had your strategic review with your board. It might be that you are constantly out of alignment with the work that's happening internally that you are seeing, the needs that you are seeing, and what might seem to be conflicting or not beneficial structures that a foundation has put in place. So there are always internal deadlines for a foundation and internal decisions and internal or competing interests that are happening that might not align with the work that you, the nonprofit or the organization, are dealing with or working in the midst of. And then finally, I'd say it's a real challenge for funders in thinking about influence and power. And that is whether it is real or perceived influence and power from both the individual program officer to the foundation level. That is truly a challenge, I think, for most funders and in all communities. So Jan, I don't know if I've lost you.
Yes, I'm sorry. Yes, I said this last about real and perceived power actually came up in the pre-registration questions, and it might be something we could address in the Q&A as well. But this really gives us an inside look at it isn't all easy being a funder. There's a lot of things that you have to manage and set to balance. So what are some of the things that you are looking for as a funder? What are some essential things to consider as we approach you?
When approaching a funder, one of the things that an organization should look for is alignment. What is the work? What is the strength of your organization? How stable is your organization? What is is the mission of your organization aligned with the mission of the foundation? Is your organization stable enough to be able to effectively steward resources? Steward specifically the resources of the foundation? And is there, from the funder's perspective, relevance? So not only is there alignment, but is it a relevant time and space for them to invest dollars? those are areas that one should always consider, and because a funder is looking at that alignment, at your organizational strength and stability, at your ability to steward the resources and your relevance. Another space that funders are looking at is time and capacity. Have you as an organization adequately thought about how long it will take you to achieve your results? Do you have in place the staff, the internal controls to do what you have proposed to do? Another area is really in understanding not just the work that you and your organization does, but in what context do you do it? What else is happening within the community? How does your work fit in with and or help to move those issues forward? So knowing that context and seeing your organization and your work and or your intervention in the midst of that context is important. Understanding who you as an organization are and what you bring to the table. So understanding your value is important and should be reflected in the requests that you make and in the conversations and dialogue that you have with a foundation. What do you bring to the table? The final piece, I'd say, is really to ask yourself the question, is this a good fit? Are we right for each other? And it really ties back to that alignment question. And I think about the role and the give and take of a nonprofit and a funder, and it's almost like a dating game. There's not always that someone might look really great on paper, and then when you guys have that first date, we really start seeing maybe this is not the best fit. Maybe we hadn't addressed this issue. We hadn't thought about that example. And so finding that right match, not just for your organization, but potentially for that specific project, can take some time. The first date doesn't always lead to the altar. A good example of that is locally here at the Houston Endowment. Several years ago, we funded for decades work around childhood obesity. Have been funding small and large-scale projects, and we're seeing a couple of years ago an increase in requests for projects. The foundation decided to start a dating process with groups that they'd funded to really talk about how do we deepen this relationship. How do we move toward, if we kind of take this metaphor further, toward a marriage? And those conversations actually led to, and this was not a simple or easy process, to a collaborative effort that included not just the city of Houston, but the county that Houston sits in, that convened and brought together a very broad range of groups, from the county and city health department to hospital systems to urban planners and insurers, so a very diverse, broad range of multiple partners to start a planning initiative to say this issue of childhood obesity is important to this community, and we want to figure out how can we curb it through policy change. And so that conversation, that dating process, moved toward a marriage, and our foundation actually funded a 2-year planning process to look at this issue through a policy lens. And the work began, and the group then called themselves Healthy Living Matters. And one of the first things that they did in developing a community action plan that would serve as a roadmap for policy implementation was a phenomenal 2-minute video that really encapsulated their idea and immediately asked the community for involvement. So Healthy Living Matters began their process 2 years ago and have just recently come out with their community action plan. So this was multiple years in the working with organizations, nonprofit, city, county government, private partners, to really think about how do we come together and collaborate. And then as a funder, we decided to have this marriage and completely funded this 2-year process. Well, that match worked because we are a funder who thinks long-term. We have been in the community for over 75 years. We have a really big footprint, so we were able to think about and look at multiple organizations and groups in this space of childhood obesity. And so it was a match. It worked from a community perspective, from an organizational perspective, and a foundation perspective. And so those are some of the things I think that it's important to think about. How do we in our work match with what a foundation is looking to do?
That's a great example. Necole and Kate has actually chatted a link to that video that you mentioned. So people can do some more look for the, we can also follow up with the plan if people are interested. Thank you. So as we finish our interview here, what are some of the essential things we should consider in working with funders?
And so I would definitely say that you should really think about and appreciate the time, interest, and capacity of your funder. Not all foundations have staff. If they do have staff, they might not, their plate might be extremely full. It might be that they are required to do all things. They might be the person doing the due diligence, the site visit, the crafting of the recommendation. So really understand and appreciate who your funder is and respect that. If, as you're building a relationship with them, if you are calling a funder, I encourage you to do that. If they don't specifically say, we don't want to have communication with you, always ask the question, is this a good time to talk? Do you have a couple of minutes? And if they say yes, then ensure that you're maintaining that couple of minutes, that you respect that time, that you understand and know what their capacity and interests are. And then the final area I'd say is maintain communication. That if you are successful in receiving a grant from a funder, don't let that be the end of your relationship. Share with them your work. Share with them what's happening, whether those are your learnings or your challenges. Think about them as a partner in the process. Think about them as being a partner for your success. And I want to apologize. I realized that I just looked at I was not being a very strong partner. I just looked at the time and realized that.
No, not at all. Kate and I were both saying we were on mute that you've really covered the bases here. It's very thorough, and thank you so much. We do have time for some questions, so let's see what questions have bubbled up here. Kate?
Yeah, so I think you've alluded to this in some way, but a question about can we invite a funder to be part of our coalition, and is it in any way a conflict of interest if they are awarding us money, or would that create a problem in them awarding us money later?
As I started the conversation, I would definitely start this response and say every funder is different. Ask the funder. So prior to sending the invitation out, give them a call and say, we are planning this event and we would like for you to participate. Is that appropriate? Can you do that? Are there any internal policies at your foundation that would hinder you from doing it? Should we invite someone else at your foundation and not you? So again, have that conversation with your funder. It's important. And if they can, both from a policy perspective, that it is something their foundation does, the next question is they might not have the time, the capacity. Our foundation does over 200 grants on an annual basis, and so the ability of being able to participate in an event for a grantee for our staff is difficult.
I think that's great advice. All right, so another question, you alluded to, really checking to make sure that your mission aligns with the mission of the funders. How can you make connections with funders if your organization's mission and priorities aren't as clearly aligned with their funding priorities?
If they are, so if this is someone who is not your funder and there's no alignment, there potentially is an opportunity to, again, share what you are doing. And that might be in the way of ensuring that they are on your listserv. It might be that you send them a letter asking to have a meeting to share the work that you are doing in that community, because don't forget, your funder is a part of that community. And so your request to share the information that's happening in your organization might not lead to funding from this foundation, but it might lead to the further understanding of this foundation of your work, and maybe 2 years down the road, as that foundation is looking at their impact, it might be that they say, you know what, we haven't been in this space. We didn't see alignment before, but the more we know about this work, we see the connection. And so there is that opportunity to make those connections with a foundation and to help influence that alignment of your work and the funder.
All right, great. Thanks, Necole. So I think last question, since we're almost towards the end of our time, how can we convince funders to break out of their normal roles while balancing the sway that they hold over other partners?
Wow, so you guys aren't, you don't ask
got some
easy
good
questions.
question askers here.
Wow, convince a funder. That's a really big question, and it's a multi-layer question. You might be able to share information and really make the case about the work that you are doing to an individual within a foundation, whether that's a program officer, a grant officer, an executive director, or president. You may be able to show and provide information to, if it's appropriate, a foundation board member. But again, it is important to remember that a funder is looking at how they can improve their community. And so I would probably, as I've skirted around this issue of convincing, so I'm not sure if that's possible. I do think that it is possible to provide the information to a funder so that they can see connections. So that's probably not the answer that that's probably not the best answer, but it's the one. So I'm not sure if you can convince. If your organization has been working in the space of providing case management to the veterans homeless population, and if an organization moved next door and said, we're going to convince you that your case management work is not as good as ours. Think about how immediately what you would think if someone said that. And So that's how you should think about convincing a funder. So language matters, I'd say, and then finally, it's all about sharing your information, and you can't share your information if you're not evaluating it.
No, I think that was a great answer, Necole, and I think it reiterates that fact that, you know, funders are like many of our other partners, that we need to treat them with respect and get to know them and make sure that they're a good fit. And so I think that was a really helpful answer, at least for me to hear it. So I know we are at the end of our time, so I'm going to turn things over to Jan.
Thank you, Necole. I'm just going to very quickly here, and if anybody asks questions in the chat and they're identified, we can perhaps follow up with them by email, and Necole maybe work with you on that to get back to some of these question askers. But I just wanted to mention that in the Action Center, there's the Take Action cycle, and in the middle are the different sectors. And if you go in to the philanthropy and investors sector, you'll find a whole guide on what funders can do and different policies and programs that they can support. And Kate is chatting the link to this. And also there is a guide to funding your initiative, which provides sources for finding funders along with other strategies. So there's a lot of resources there in the Action Center. We always end with, here's, please stay connected with us, and please let others know about these webinars and forward the e-newsletter information to them. We would like to acknowledge the wonderful team that is behind all of this and our terrific partners. So we'll just end by listing them here. And we started with this essential question: how can community leaders and funders work together to amplify efforts? We hope that you feel like you have some answers to these questions, and perhaps you have some new questions that will prove fruitful to your efforts. So finally, who else do you need to share this information with? And what's one idea for action that you're taking away? And what else would you like to know? And just feel free to get in touch with us, and we will get back with you. Thank you, Necole, again, so much for your time on this webinar. Your expertise is wonderful, and your experience, and for taking us through looking at funding through the eyes of a foundation, and what does the world look like, and what should we be thinking about as we are other partners approaching you. And thank you all for joining us on this webinar, and we look forward to hearing from you in the future. Thank you very much. Bye-bye.